Alcohol-related deaths are on the hidden toll, one of the hidden tolls of this pandemic. Stress drinking, self-medicating, depression, and disrupted access to treatment, some of the causes for this. CBS 46 investigative reporter Crystal Bowie looks at the rising numbers and how the state is working to help those battling alcoholism.
Alcohol-related deaths in Georgia have steadily been on the rise since 1999, and now many are working to intervene before it's too late.
Alcohol became my best friend when I was 15 years old. I was what is considered a blackout drinker, so every time I drank, I blacked out. I would get up to 25 to 30 beers in a day, mixed with alcohol on top of that.
It took Erin Campbell more than a decade to admit she had a problem.
15 years of drinking pretty heavily.
One drink was never enough.
It was the way that I dealt with my emotions. That's how I escaped. I couldn't even just survive, go throughout the day without being able to drink and numb out those feelings.
Campbell's alcoholism and anxiety got worse and worse.
I had that just thought inside of me, I just want to die. I wish I could just run off the side of the road. I wish I could just not wake up tomorrow.
She isn't the only one overtaken by the disease.
Most people who are finally coming to where they're asking for help, at some point in time they have had that feeling of wanting to die.
Alcohol-related deaths are on the rise, especially as state health officials say the pandemic exacerbated loneliness. More people started binge drinking alone.
Most people sometimes don't like to hear this, but the use of alcohol and then the abuse of alcohol, all of it is associated with pain. They're in social pain, they're emotional pain, psychological pain, economic pain. So you can even add that on top of COVID.
More than 2,200 died from alcohol in 2020. That's the highest number Georgia has seen in 22 years, according to data from the Department of Public Health. Georgia health officials are well aware of this growing problem. The state has put out 9 new substance abuse programs in response to the crisis, and the treatment program includes funding for medication.
The use of medication allows individuals to not have the cravings long enough to be able to engage in treatment and behavioral health therapy.
The largest age group dying were between 55 to 64 years old, but it doesn't mean those younger or older are immune.
I'm too ashamed to tell anybody that I drank so badly that I almost died the night before.
Now 11 years sober.
We definitely need to get you over to detox first.
She's turned her life around, working as the director of admissions at Summit Wellness Group, an alcohol treatment and drug rehab center in Atlanta.
We don't have to think about, I can never drink ever again. It's too over-whelming in the beginning. It's just, don't drink today, and then tomorrow we're going to talk about it again.
And hopes sharing her story will help others take action and stay alive.
People feel weak for asking for help, but really the weak thing to do is just to continue on drinking and covering it up and covering it up. But the moment that you say that I need help, it's the strongest step that you've ever taken.
The state's program is open to applicants who want help. They're also doing outreach in emergency rooms to see if they can prevent any future hospitalizations. We'll post more resources. Go to CBS46.com. Reporting in Atlanta, Crystal Bowie, CBS 46 News.